Western differential diagnosis for epigastric pain. From the perspective of Western medical diagnosis, the most important task is to differentiate between the organs from which the epigastric pain may stem. These can be esophagus, we have esophagitis, carcinoma of esophagus, stomach, gastritis, gastric ulcer, perforated ulcer, carcinoma of the stomach, duodenum, duodenal ulcer, pancreas, pancreatitis, carcinoma of pancreas, large intestine, appendicitis, irritable bowel, gallbladder, gallstones, acute coronary syndrome, or ACS, inferior wall myocardial infarction. Esophagitis is an acute or chronic inflammation of the lining of the esophagus. The most common cause is a condition known as gastroesophageal reflux disease, and a hiatal hernia can worsen GERD symptoms. Common signs of esophagitis include pyrosis or heartburn, acid regurgitation, dysphagia, difficult swallowing, odynophagia, painful swallowing, chest pain, particularly behind the breastbone, epigastric pain, and food impaction, swallowed food becoming stuck in the esophagus. Carcinoma of the esophagus. In most cases, this manifests with dysphagia, difficulty in swallowing, and it may be rarely associated with thoracic or epigastric pain. Gastritis is a general term for a group of conditions with one thing in common, inflammation of the inner lining of the stomach, known as the gastric mucosa. It may occur suddenly, acute gastritis, or develop slowly and last for a long period of time, chronic gastritis. A number of conditions, such as Crohn's disease, can increase the risk of gastritis. Risk factors include older age, regular use of pain relievers, abuse of anti-inflammatory drugs, excessive alcohol use, stress, autoimmune disorders, and bile reflux. In addition, gastritis can be associated with bacterial infections, particularly Helicobacter pylori and pernicious anemia. Main symptoms of gastritis include pain and burning ache in the upper abdomen, stomach cramps, nausea, vomiting, and a feeling of fullness after eating. Gastritis does not always cause signs and symptoms. Gastric ulcer is characterized by ulceration of the stomach's mucous membrane. The most common causes of gastric ulcers are infection with the bacterium H. pylori and long-term use of nonsteroidal anti-inflammatory drugs. Irrespective of its cause, the mechanism underlying ulcer formation is always an imbalance between factors promoting mucosal damage and factors promoting gastroduodenal defense. Gastric ulcer causes epigastric pain, which comes in bouts lasting for a few weeks or at intervals of months. The pain occurs approximately 30 minutes after eating, and it is not relieved by eating. There may also be nausea, regurgitation, and distension. If the ulcer perforates, this is a serious emergency, and the patient should be hospitalized as soon as possible. It is characterized by a severe epigastric pain, which soon spreads to the whole abdomen and is aggravated on coughing and deep breathing. The patient looks very distressed, and the abdomen is rigid and hard and characterized by board-like rigidity. Perforation may cause severe signs and symptoms such as nausea, vomiting, sweating, tachycardia, and weak pulse, and the patient assumes a fetal position. This is followed by an increase in the pulse rate, and the patient's condition becomes more and more grave. The symptoms of stomach cancer can include dyspepsia, heartburn, or stomach pain, digestive problems, a sense of fullness after eating a small meal, feeling bloated after eating, nausea or vomiting with or without blood, blood in stool, difficulty swallowing, fatigue, poor appetite, vague discomfort in the abdomen, usually above the navel, and unintentional weight loss. Thank you for your attention.